Welcome to the Franklin Method Fellowship. I'm your co-host Solange Ross, and I'm joined by my colleague Deborah Chassie. We are physical therapists specializing in the pelvic floor. In this podcast, we share our passion for the Franklin Method, an evidence-based therapeutic approach using mental imagery, movement, and awareness to improve posture, the way you move and feel, and overall well-being. We integrate the Franklin Method into functional everyday movements, all forms of exercise, and our physical therapy practices. We also share a love for talking about the pelvic floor. We hope to inspire you to move better and feel better in your body. Always check with your doctor before beginning an exercise program. This podcast is not intended to be used as medical advice. Let's grab your Franklin Method balls and bands. Enjoy the show.
Hello, welcome to the Franklin Method Fellowship. I'm Deborah Chassie, and I'm here with my colleague Solange Ross, and we're really happy to have you join us for episode 14. And today we're going to be talking about the hips. Hi, Solange.
Hi, it's so great to see you. I'm happy to be here.
It's great to have you here too, and be working with you again. I love it. So, what do we know about the hips?
Well, we hear a lot of things about the hip. Certainly when people walk up and down stairs, they can feel stuff in their hips. I hear a lot of people talk about piriformis pain, sciatica, and when they're doing an activity for a long time, the hip can really be one of the things that makes people want to stop and rest. What do you think?
Yeah, I think a lot of people complain about going up and down stairs, like I can't go up and down stairs anymore, or I can't run anymore because my hips hurt, or they'll come in as a patient complaining about sciatica pain. I just had somebody yesterday saying how she had sciatica pain traveling down her leg from her pelvis. And yeah, there's so many complaints. Oh, tight hamstring. A lot of people complain about that. And when we go to do the evaluation on them, we actually find not only do they have tight hamstrings, but they have tight pelvic floor muscles too.
Absolutely. And we know that one part of the pelvic floor certainly relates to the hip, in particular, our internal rotation and our external rotation. And that if we have tight hips, it certainly puts people at a risk factor to have low back pain. And low back pain is one of the most common diagnoses, if not the most common diagnoses in physical therapy. Wouldn't you agree?
I totally agree on that one. I have so many people coming in with low back pain, and it's very common in people with pelvic floor dysfunctions too. They have low back pain in addition. So that's one of the things that we test on patients is to see what's going on with their low back pain, or if they have it, or even, I'll ask them to do a bridge, just a little bridge, and see if they have any pain associated with it. So, yeah, and then there's different types of exercises that are traditionally given in physical therapy. Like squats, bridging, deadlifts, clamshells. But what if?
Yes, definitely a traditional hip protocol focuses on a lot of muscle strengthening, targeting all the muscles that cross the hip joint. But as you were going to say, we're going to present something a little bit different today, right?
That's right. That's right. Well, and the positioning of our hips, so I'm kind of backtracking a little bit here with our posture, but the thing with if our hips are not in a good position and we're not using them correctly, then it's also going to affect our posture. So I think it would be good if we actually stand and notice our posture in standing. So Solange, when you stand, do you ever stand like this or like this? Especially when you're carrying a baby, right?
Certainly. I mean, I spent a significant time like that because I had 3 babies. But I even
Mm-hmm.
notice when I'm waiting for the subway where I'm somewhere where I'm stationary, right? That like
Yeah.
there's this tendency where like I'm on one leg and I'm shifted to the side. And I'm
Mm-hmm.
not actually like here, if my hips are shifted over to the right, I'm not actually bearing weight through this hip. If I
Yeah.
want to bear weight through this hip, I would need to bring the hip back to the center and get my spine and my upper body really centered over the hip. So what happens is when I hang out like this here, I'm really doing a lot of work with my lower back.
Yeah. Yes.
And I want
I
everyone, right, to just shift side to side and kind of get a sense of, is there a preference that your body has for what side you like to hang out on?
You know what
And
I'm
then,
noticing too is that when I shift to one side, on that side, I feel the muscles on the back firing up, not painful, just contracting. And then if
mhm,
I shift to this side, I feel the muscles on the left side contracting. Do you feel
mhm,
that? Right? Because that's
definitely.
telling me how much more the lumbar spine has to work when we shift our weight like that.
And then I'm also noticing what's going on in my rib cage too, because as we shift over, right, our rib cage isn't going over as well. Our rib
Right.
cage is kind of going to counterbalance
Yeah.
us. So we're going to notice some shifts in the ribs.
Hmm.
And then we can also just take our weight and push our weight so like we take our pelvis all the way forward in space. See how that
Oh, look what
feels.
happened.
Oh,
I'm gonna,
something's
I'm gonna
coming
tell,
out.
I'm gonna tell our audience what this is. So these are where my femur heads are located. They're a lot closer than we think, right? And on it, I'm gonna get a little bit closer. I have a pupil, so I'm showing these to be the eyes of where the femur heads are located.
I'm so glad that you're showing that because so many people, when they think about where their hips are, and even you've heard, put your hands on your hips and people go like this. And
Mm-hmm.
that's actually the pelvis.
Yes,
It's
right.
not where the hip joint is, where that head of the femur is going to meet the acetabulum of the pelvis. So this is a completely different part, not our hip joint. So we can
Yeah.
take our pelvis forward and then we can also take our pelvis back in space. And just as you go forward and back, notice what feels more comfortable to you. And then as you come back to the center, notice, do you feel your weight from your upper body down to the floor, to your feet? Do you feel it going through the hip joint? Or do you feel it in front of the hip joint? Or perhaps behind the hip joint? And what does it feel like right to left? Do you feel like you are going through both hip joints with the same amount of weight? Are you in front on one side and behind on the other? So maybe in a rotation. And these are all just things in this first exercise just to notice. So we're not going to look at these things and think, oh my God, I'm rotated, I'm crooked. We're just noticing. And then as we go through our practice today, I'm excited to see the changes that we'll notice in our hips.
That's always exciting to see the changes.
So
Yeah,
shall
I
we?
think so. I'm going to describe what I'm feeling. I'm slightly forward. So I'm not forward like this, but neither am I back and neither do I feel centered. But if I do go into my normal stance, I tend to lean more forward on my feet. So then I am more forward.
Yeah, and
So
I'm
it's good
actually
for
the
people to
opposite.
notice where they're at and to be able to describe it.
Yeah, and I'm actually
Oh,
the
really?
opposite. Yeah.
You're more back, huh?
I'm more back. I tend to have my weight a little bit more shifted back on the heels, and there's certainly a part of my back that I can hinge and move. from in one segment. So yeah, I can definitely notice the weight a little back. And I encourage you to notice what
Hmm.
you notice. Shall we
Yeah.
check in?
So let's go ahead and do a check-in. Yeah, this is a good time to check in.
Yeah, so
3, 2, 1, and we'll just notice our bodies. Eyes closed. Welcome back. And Solange, what did you notice in your check-in?
I really liked that check-in. And I think because we had just talked about how the head of the femur is really more inward, I was sort of feeling this kind of like shifting back and forth, like almost like my two heads of the femurs were playing ping pong with each other or talking to one
I
another.
love that example. That's awesome.
Like I'm supporting the pelvis from this side and then I'm supporting it from this side. So it was just this cool sensation that I felt in the hip joint. How about you?
Noticed it in the front of my lower leg, the anterior tibialis muscle, and also the top of my feet. I just actually felt more supported there.
Mm,
Yeah.
nice.
Yeah. So let's look at the anatomy. Here we have the upper leg bone. It's called the femur. And last time we talked about the knee. So this is the knee complex. And here is where we have the hip that joins into the socket. I'll show you the socket in a minute. But I want you just to notice how round this called the femur head. And we're going to be talking and using that word a lot, femur head. So the head is what fits inside the socket. And this right here is the femur neck. And if you touch the side of your leg, the upper leg, this is what's called the greater trochanter. I actually use this all the time to test the pelvic floor and standing. I just put my hands on it and on both sides and ask the person to do a pelvic floor contraction. And you can actually feel the fascia pull with the pelvic floor contraction. Pretty cool.
Nice.
Yeah. Anyway, a little side information. So I'm going to show you the other model because I want you to see how it fits into the socket. Here we are. This is the femur head that we were talking about. And here's the pelvic half. I'm going to just show you more of the pelvic half. It's curved over here. And then here is the bone that you sit on. So a lot of times we'll refer to it as the sit bone. And here is the sacrum. And this is the iliac crest. And this is where a lot of people will place their hands thinking this is their hip.
Yeah.
That happens a lot. And interestingly, too, right here is a special point that we like to test to see how the hips are moving, called the ASIS. You don't really need to know that right now. You just want to notice the femur head. And what I did is I put an eye there with a pupil on the eye so that you can see how it actually does move. So
Definitely.
why
And
don't,
I can want to
oh,
also
look at
just show.
you.
So this is my femur, and I've drawn this big eye on it. And just to also give a look at how it meets with, I have one half of the pelvis.
Mm,
So we can get a sense of that. Our femoral head and then our pelvic half.
yeah.
And
Well,
when I was at the Franklin Method course with Franklin Method in dissection, we actually dissected the hip joint and someone did a beautiful job removing the femur. And it was just so beautiful when you saw it's such a beautiful shape. I was just in awe that it was just like the body is such a miracle. Like, how do we have this perfect, smooth femur head in our body?
That's great. I love your eye on there. That's awesome with the eyelashes. Let's go ahead and find the femur heads on our own body. Find your iliac crest, which is just below your waist. It's that bone that you feel. A lot of times people think that this is the hip, but the hip, I'm going to show you where to go. So if you slide your hands down, and right here is a soft spot, and then if you go a little further, that's the greater trochanter that I talked about. So go just above the greater trochanter, and look what I did here. I wanted to show you my eyes. And then you're going to slide your hands in close to the center of you, almost to the pubic bone, right to the edge of it, and then just down a little bit. And if you have your fingers there, just go ahead and flex slightly at the femur heads and feel that movement.
And another way to think about where that head of the femur is if you think about your bikini line and you go to the midpoint of the bikini line, that will also give you a sense.
That's a good explanation too. So I'm just showing you where my femur heads are at by lifting my shirt a little bit.
And I encourage people to let's just try bending with the idea that maybe our hip joint, where that femur head is, in the place where our greater trochanters are on the side, and just see what that feels like.
Feels unsteady.
It feels unsteady, and I don't get a good sense of like a folding of the hip. Like, I can really get more folding and more flexion when I think about that point being more internal, like we just described.
Right. So let's go ahead and go back to, after repeating several times with our fingers in the right place, and then just go ahead and notice our posture. Did everyone get a chance to flex at the hips with your hands in the right place, where the femur heads actually are? And then just stand and notice your posture in comparison to having your hands on the side. I don't even want to think about my hands on the side anymore. But I feel really lifted in the abdomen.
Me too. That's exactly what I was going to say. I feel really this nice support from the legs, and it's sort of, then from there, it's almost like an arrow that goes up my midsection.
So if we imagine these to be eyes and we flex at the hip, imagine the acetabulum, which is the hip socket. So I'm going to bring this down like this. So here I have the eye and the eye. And imagine that as you flex at the hip, that the eye is disappearing because it's going into the socket. So kind of like you're closing your eyes, right? Eyelid covering the eye.
Yes. I really like that image of the eye. It actually gives me more range of motion when I go down. So this would really be a beautiful image to try on if you're doing any type of weighted squats at the gym. A great image to use.
Or climbing stairs. How about that?
Climbing
when you go to climb stairs, think about the eyes closing, going into the socket.
And anytime you get up and sit down from a chair, right?
Yeah, that's an important one.
Like,
so many people.
Go ahead.
so many people will plop to sit down, especially as they get older. They don't use their muscle strength to lower themselves slowly. Or when they go to stand up, they'll push up so they aren't using their strong leg muscles to get up, but they're using their hands. Or one thing that sometimes people do is they'll push up and then they kind of use momentum to bring them up and then they pop. I'm sure you've seen that plenty of times, and they'll pop. And that over tightens the pelvic floor too.
Definitely. And also if they pop up at the top, right, that's putting a lot of stress on the ligaments that holds that femur head in place. And that's another thing that even if you're doing like squats or like thrusters type movement, you want to be careful with that you don't at the top like really pop and put stress, because that's really pushing that femur head forward. Or we want it to be nice and centered in the socket.
Right. Did you see this good enough?
Yeah.
Yeah.
And I can also show with my eye and my pelvic half what would happen when we bend. So when we're bending, we're getting movement in the femur and the pelvic half. And then as we stretch our legs, then that eye is going to open. So can you see how that eye is going to close? And then it's going to open. And this is the point where we need to notice, are our eyes closing and opening equally and in a balanced fashion?
Ooh, try closing your eyes when you do that. When you flex. Does it accentuate it more? And then open when you go to stand up?
I definitely feel that when I close my eyes, it's more of a balance exercise. So make sure that you feel safe and well supported if you're going to try that. But I certainly can feel more of like a shakiness when I do that.
A shakiness? You mean like unsteady?
So when my eyes are open, I feel, I guess you would say, more steady, or the movement feels more smooth. And then when I close my eyes, I certainly feel a little bit more like maybe it is that I can sense that both aren't moving symmetrically. There's a little bit of movement in one and then the other.
Oh, I see.
So maybe that's what I'm sensing, a little bit of asymmetry in the movement.
I noticed that when I close my eyes, when I flex, and then open my eyes when I extend, that I feel more aware of my femur head. And I think that's because we drew an eye here on my body and also on my skeleton. So Solange, did you try that? And what did you notice?
Yeah, so when I close my eyes, I definitely can feel that as I go down, I'm not 100% symmetrical with my weight, that there's like a little shift and then it corrects itself. And then when I extend and open my eyes, it feels much more centered. But I think that's good information to do it with the eyes closed, because that also, when we close our eyes, it takes away what we're looking at, so we can really focus in more in the sensations in our body.
How about we go ahead and sit on our balls and roll on our glutes to help center our femur heads more?
Yeah, I'd love that.
So let's put the orange balls under our sit bones. I have one here, and I have another there. And what we're going to do is roll on our sit bones, because what we'll be doing is rolling our glutes. So I'm going to roll in circles. And this can be done in supine as well. We'll show you after. And then sometimes the balls move on me, so I have to adjust them.
Hmm.
And so,
And if people want to try for something a little bit more intense and they have the range of motion, they can cross one leg and then roll on one. This can be an option. And where I feel that that I'm rolling is all around that greater trochanter. And if we find a spot that's a little bit tender, we can pause there and take a breath in and exhale and think about that tender spot just melting. And then we can continue to roll back and forth.
I also like rolling side to side. What I'm feeling when I roll is when I shift to the left, the ball is on the inside of my sit bone. And when I shift to the right, the ball is on the inside of my right sit bone.
As people bring the balls a little bit more on the inside of the sit bone, just to notice that that is an area that can be a little more sensitive when you're more on the inside. And if at any point you get tired of supporting your body weight with your arms, you can just come off and rest.
There's another position that I like better than that one, and I'm going to show you. You lie on your back, and you can see me okay.
Yep.
And I place the balls under my pelvis, so it's above my sit bone. And then I just roll side to side. And I love to do this after exercising because it really massages my glutes. And
Feels
sometimes
really nice.
if I feel some extra tension, I'll spend a little more time on that side, whatever side it may be. Today it feels really good. No tender spots today.
Nice. So
And
I know people have all done different hip exercises like the clamshell, right? Like that's a popular
mm,
exercise that people have done at the gym. So
yeah, that's
a lot of times when people are doing the movement, they're really focusing on the muscular sensation that they're feeling around the piriformis and maybe around the back of the hip. So what we want to show you today is how to create a balance in the musculature by focusing on the movement of the femur head. So I'm going to grab my femur head. Here it is.
and I'm going to
And
draw your attention to where my femur heads are at.
and so if I come onto my side, and here's my femur, when we close the legs, we can think about the eye closing. And then when we open the legs, the knees apart, we can think about that eye opening. So knees closing and opening. When we close the knee, we close the eye. When we open the knee, we open the eye. And you can either be propped up on your shoulder or you can be nice and supported on your side with a towel roll under your head. And we'll do a few of these clamshells with the eye opening and the eye closing. And really put that image of the eye right where you sense your femur head meeting the socket. And we'll do that one more time. Eye opening and then eye closing, and then just let the leg relax. This also can be done if you do different exercises where you rotate the leg and stretch the leg. This would be a great opportunity to focus again on closing the eye and opening, closing the eye and opening, versus just counting repetitions or putting your focus on a muscular burning sensation. If we follow the image, then our muscles around the hip joint will work in the right amount.
I think we might want to do the other side as well. What do you think?
I think so.
And before we do this, let's talk about how to get up from sitting. I mean, from lying on our side. So the best way is to place our top hand on the mat and use our elbow to push ourselves up. And then we can switch to the other side. And notice what I have here. I have a cushion, a cushion under me. It's a nice chip foam type of a cushion.
Yeah. And a lot of people, if you get some sensitivity around the greater trochanter, you may want to put a towel roll. So you could use a towel roll or a cushion there. And same thing, you could push something underneath your forearm if you need, or anything to support the head and neck when you're on your side. Really getting into a good setup is important. So we'll come on down. And then we'll open the knees and close the knees. And imagine that femur head. And take your hand and actually, with your fingers, you can really put your hand so you're on that fold of the hip. And the eye opens as you open the knees, and the eye closes as you close the knees. Eye open, eye closed. And notice, does it feel the same when you do this side, or does one side feel a little bit stronger? I can definitely feel a difference in the sides. This hip seems a bit stronger, and I know that when I'm standing, my left side is the one that I tend to pop that side out. So I know that I'm not using the hip muscles there, that I'm maybe using more of my back. What do you notice, Deborah?
I'm noticing that I'm using my glutes. I don't usually do this exercise, so I'm really feeling it. I do other hip exercises though, especially in standing.
And again, that if we do anything where we're lifting the leg up or pushing the leg out, we can do that same imagery focusing on the hip. So as we rotate out, think about the eye opening, and rotating the leg in, think about the eye closing. What I really like about the imagery of the eye and with my hands here is that it really encourages less compensations that can happen with the lower back and other areas of the body. And what that would look like if you were using your back would be sort of a rolling back when you're doing it. So if you follow just the image and keep your focus on the hip joint, you will be more likely to work those muscles in a balanced fashion and eliminate the compensations. All right. When you're ready, you'll push yourself up into sitting. I think we got a little workout there, would you say?
Yes, I did. And it's funny because I swim a lot and then I do exercises in the pool and I do some different types of squats on the power plate. So I definitely do a lot of hips, but that one I'm going to have to keep working on, keep doing it because I could really feel that. Using the image of the eyes opening and closing during the clamshell really helped with the movement and made it more smooth and fluid and more efficient. I feel like I was able to do more than I normally would have been able to do.
Definitely.
Shall we show how to stand up?
Yeah.
So imagine being an older person, because the reason I say that is when people age, sometimes they fall. And when they fall, they have to be able to get back up again. And there's so many times where they can't get back up. And so they lay on the floor for hours before anybody finds them, sometimes days. And so you want to make sure that you know how to get up from the floor and do it as simply as possible. So what I would suggest is when you're in this position to be able to then go to your hands and knees and bring your foot under you, and then the other one, and you start to push up. And Solange, do you have a better suggestion?
Well, I just want to show for a moment too what I see a lot of people doing is that once they make it onto all fours, then they sort of push themselves up and use their back to get up. And then even to get back down, they use their back to come down versus their legs. So I think the more people can get the legs working,
I'm glad you're pointing that out.
the more people can get the legs working and maybe use in a practice, use something where they have a chair next to them or they do it next to the couch so that they're on all fours and then they can use the couch and push with the legs to come back up. That can be a nice way to practice getting down off the floor. And one thing to really point out is as people age, they really stop going down on the floor, or it's harder when they're going down on the floor to play with their grandchildren. They might not be able to be there for very long. And we really want to practice getting up and down on the floor because we're really using our hips through a more complete range of motion than just going into a chair. And so we want to continue to use that range of motion for as long as possible. And practicing getting up and down and being on the floor is a great way to do that.
I think that's great too. And I think really focusing in on the legs, using the legs to push up or to lower yourself is really important compared to using the back.
Definitely. And even just to see from the back, if I'm here and using the chair, my back is not flexing.
Right.
Whereas if I'm here and I bring my leg forward and I'm still using my hands, you see how much my back has to do the work.
Yeah.
And it's okay.
So you're suggesting
it's okay for the back to do some work some of the time. We just don't want the back to be doing the work all of the time. And we want to practice different ways of getting up and to really give our body some really nice options for movement.
And I think that if we actually practice using our legs to get up and get down, that when the time comes where we need to, maybe we're in a difficult predicament or fall or something like that, that we're used to using the right body mechanics, and chances are that we'll still be stronger even if we use our back in a difficult situation.
Absolutely. And that practice is really what helps build the patterns. So we definitely want to be practicing that.
Yeah.
Yeah.
I did some research on Google, and what I wanted to find was, what do people do most of the day? Or what activity are they doing most of the day? So if you would call sitting an activity, we sit more than anything else.
Yeah.
And sitting is not really good for our posture if we're sitting incorrectly or like this on the computer screen, right? That's not good posturing.
Or even
And
if we
then,
are, right, even if we are in a good alignment, but we're there for a very long time and we don't move, it's sort of just the amount of time in one position,
true.
right?
Yeah. 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 So in order to get to sitting or to get out of sitting, you have to stand up and then stand and then you're going to sit down. And so what we want to think about is how we actually do that movement. And if we're using our back or pushing, so it's easy for people to want to push out of a chair or they plop. I see that so often where people are slouching, plopping. It's one of the things when they first come into my office, I give them a nice chair to sit in and I always observe how are they sitting and how are they standing up.
Yes, that tells a lot.
Doesn't it? Yeah,
Yeah.
I can tell what strength their pelvic floor is just by how they sit on the chair. If they're like this, I know that they have a tight pelvic floor muscle.
Or if they're like this, that maybe there's some tightness on one side and the other
Hmm.
side maybe a little more stretched.
Yeah,
And
yeah.
also, it's very telling too when someone is very squirmy when they sit, right? And constantly shifting around and just can't
Mm-hmm.
settle.
Yeah, they can't get comfortable. Something's too tight, causing problems or not strong enough.
But I know that this sit to stand is something that I do a lot because, especially with my children, they always want something. So, as
Mm,
you can imagine, I'm not sitting for long.
yeah. I raised four children, and I know exactly what you're talking about. You're not sitting for very long.
No.
So when we go ahead to stand up from a sitting position, let's really think about what we're doing. So we know we're sitting on our sit bones right now. And if we go back to these eyes, and if you lean forward, think about the eyes closing because the the acetabulum or the socket is sliding over the femur head.
Mm.
And now, if you're not forward far enough, it's going to be hard to push yourself up. So if you sit back a little bit and feel that and then try to get up, you can't get up, can you?
No, that's
No.
hard.
So you have to push yourself forward. Your knees have to be bent. And if your knees are just at a 90-degree angle, that's still not enough to be able to get up. So you have to bring them back even more to about 110. And then keep your hands free from touching anything. You can just let them rest on your lap or on your side. And then you're going to lean forward. So a big eye winking. And then you're going to push yourself up with your leg and just standing. And when you come to standing, you want to keep the femur head sitting nicely with the socket over it. The eyes aren't closed, but they're not popping out either. So a lot of
Mm.
people, they come to standing like this, and then they pop at the end. And they hyperextend their knees, they pop their pelvis forward. And it's really bad for the ligaments on the femur head
Right. And we
or
don't
at
want
the,
our eyes, so we don't want our eyes bulging out of their sockets.
right. Right. That's definitely a problem. Yeah. And so then when we go back to sitting, so think about your thighs and think about your sit bones. And I have two flashlights here too. I kind of like this. They both on? They're both on. I don't know if you can see them. And so if you imagine that the flashlights are there at the sit bones, I'll move them when it's time to actually sit down. And the sit bones are being directed to where we're supposed to sit and lower ourselves. So notice when I get to this position that my eyes are closed, right? The femur heads are tucked in the acetabulum, and then I can sit up and relax.
Hmm. I really like that. And I felt really very secure with the flashlights those beams of light guiding me down. It really
Mm,
felt like very safe and secure.
yeah. What if we think of it like a spaceship. I'm going to stand up and then think of the lights as some sort of a spaceship landing. Yeah, right. So going down, and you've got the tailbone too. That's just kind of creating a wider space.
I like that. I was thinking of some like alien ship from each sit bone going
That's
down.
where my mind first went to, is an alien ship. Right. And then what about a spaceship taking off? And so then, right, I love that noise.
I like that. But the
then
idea
they're
of a
gonna try to fly.
spaceship, taking off and just like the sound, like that really gave some power to get off of the chair.
Mm-hmm. Yeah.
One
Right.
thing
Because
while I was noticing,
when we go to sit correctly, it does take some concentrated lowering, doesn't it?
yeah, well, I'm thinking, when I do all of this stuff and I'm sort of, on automatic pilot going throughout my day, I'm certainly not sitting in this way because when you do sit in this way, you really feel more balanced and centered. And then what I find is that I'll catch myself just like
Oh,
in this
totally.
position. So
I know.
how did I get there? That's the question. Did I kind of get there
Yeah.
by going like that?
Yeah. Right. I notice when I'm sitting, I may start out in a good position, and then after a while, I start to get lazy and sit back and cross my legs, cross it the other way. But something that I like to do too is I'll put a pillow behind my back so I can lean into the pillow.
Nice. One other thing I was thinking about that is a nice image for this leaning forward is thinking about the pelvic half polishing the femur
Mm,
head.
yeah,
So that's
I
a
like
really
that.
nice activity to do. If you think about the acetabulum, the socket, and we can even create one hand can be our femur head, the other hand is our acetabulum, the socket. And so as we go forward and back, we can imagine the socket, our hand, polishing the femur head.
That feels good.
It feels really good, just a nice thing, nice activity to do when you're in
Hmm.
sitting. If you find yourself sitting a lot and you think, hey, I want to move, it's not only about crossing the legs and then saying, well, I'll cross them this way. Like, well,
Hmm.
no, let's get some polishing over our femur head.
I'm really noticing it in my hip socket. It feels so good. I think we have to do the other side. Otherwise, I'm going to be imbalanced.
I've already started to do the other side.
Uh, yeah, it just makes me really notice my hip socket and the femur head within the socket.
And there's that moment to notice too. So are we polishing both femur heads equally and in a balanced way? Or do we feel like one we can polish a little bit more and the other doesn't have as much range of motion? And can we try to encourage that with the image? And we could just notice our
Yes.
sitting posture after that.
It's easier to sit up.
It is, and I'm really aware of just the femur head supporting the pelvis,
Mm.
that connection. Like even though we're sitting on our sitting bones and our sit bones are supporting the pelvis, I feel this sort of anchoring from each femur head as well.
Yeah,
So I feel
yeah.
anchored from the sit bones and then anchored from the sockets at the same
Mm.
time.
Yeah, that feels really good.
Well, I'm much more excited about this activity of sit to stand and sitting in general. Like, I actually found it really fun.
Yeah. Well, there's one more exercise that I want to do that has to do with the bone rhythms. And we're going to need to stand up to do that. But this one I really liked a lot when we did it the first time, and I still love it because it just gave me such a better sense of movement, more flexibility. So are we ready to try that?
Yes.
Last episode 13, we focused on the knee and we talked about the bone rhythms between the knee and the lower leg. Today, we're going to talk about the bone rhythms between the pelvis and the upper leg. So when you bend, before we do that, go ahead and place your hand on your hip. So here's the iliac crest, and I want you to come down to that bony part just below, about an inch below where your hands were at here. That's called the ASIS. And what I want you to feel is when you bend your hips and knees, can you feel your hands rotating in as they're on that ASIS? And just kind of notice how that feels. And I'm actually noticing on my right side, it doesn't rotate in as much as on the left side. Ooh, I bet that's going to change.
And something that people may also feel is not necessarily the movement in, but as they stretch their legs, the movement out. That may be a little bit more apparent as they come into leg extension.
That's true. Now that you say that, I can really feel that.
And then we can begin to, with our hands, kind of assist as we bend down, giving a little bit of a push in on the ASIS. And then as we stretch our legs, giving a little bit of a tug, like tugging it out to assist. What just came to mind with this bone rhythm of the pelvic half is just the narrowing in front in the widening in back. And then as we come up, the narrowing in back, widening in front. That might be an easier image for people. Narrow in front, widen in back, narrow in back, widen in front to help with that rotation.
Narrow in front, widen in
back, narrow in back, widen in front.
Widen back,
widen back, narrow in back, widen in front. Narrow in front, widen in back, narrow in back, widen in front.
And so if we take that and then bring our leg into the picture, when we flex at the hips, we know that the pelvis is narrowing in front and opening in back. At the same time, what is happening at the femur? We know that the joints counter-rotate with each other. So if the pelvis is narrowing in front, that means the femur is rotating out when we flex. And when we extend, the femur is rotating in and the pelvis is widening in the front, so it's rotating out. So if we put our hands, one hand on your pelvis, I like to do it kind of across the body because I want to feel that pull in. And then I want to put my other hand on my femur and feel the pull out so that I'm getting this counter rotation. So I'm going to flex and I'm going to say, put my hand in position. I'm going to say pelvis in and femur out.
Femur out.
And femur in, pelvis
in,
out.
Pelvis out.
Pelvis in, femur out.
Femur out.
Femur in, pelvis out. Pelvis in, femur out. Femur in, pelvis out. Pelvis in, femur out. Femur in, pelvis out. And let's do it a couple more times. And pelvis in, femur out. Femur in,
pelvis
out. pelvis in,
in,
femur
femur
out,
out,
femur
femur
in,
pelvis
pelvis
out.
out. And then just stop and notice your posture. What do you notice in your posture?
I definitely feel a bit more lifted on my left side.
I feel
And
lifted right in here, right in the center.
and I feel more open in the shoulder as well.
Wow, that's nice.
Mhm.
Let's do the other side. We're going to cross our hands. So one hand will be on the pelvis, one hand will be on the femur. And as we squat, we'll say as we squat, we'll say pelvis in, femur out,
Pelvis
femur
in, femur out,
femur in, pelvis out,
femur in, pelvis out,
pelvis in, femur
femur
out,
out,
femur in,
in,
pelvis
pelvis
out,
out,
pelvis
pelvis
in,
in,
femur
femur
out,
out,
femur
femur
in,
in,
pelvis
pelvis
out,
out,
femur,
pelvis in,
pelvis
femur
in,
out,
femur out, femur in,
in,
pelvis
pelvis
out,
out,
pelvis
pelvis
in,
in,
femur
femur
out,
out,
femur
femur
in,
in,
pelvis
pelvis out,
out. And one more time. Pelvis
pelvis
in,
in, femur
femur
out,
out, femur
femur
in,
in, pelvis
pelvis
out.
out. My spine feels so supported.
Mm.
I feel really lifted in the abdomen, strong in the feet.
I also have a nice sense of those femur heads supporting the pelvis. And I have
Mm,
this, I'm just feeling this kind of internal sway back and forth of just, again, like playing ping pong from femur head to femur head,
I love that image.
but very, very small. It's like the slightest movement.
Hmm. How about imagining that our legs are like an ice cream cone on both sides, so a double ice cream cone supporting the femur head. And the ice cream is nice and rich and thick and hard.
Yeah, nice and hard so that it can support the pelvis on top of it.
Yeah, it has good balancing because you could put a cherry on top.
Should we try putting those bone rhythms together? I love
Sure.
doing it pelvis in, femur out, just sliding my hands like that. And
Mm-hmm.
then femur in, pelvis out. Pelvis in, femur out, femur in, pelvis out. Pelvis in, femur out, femur in, pelvis out. Pelvis in, femur out, femur in, pelvis out. And if we wanted to bring back going all the way down the chain from our last episode, when we looked at the counter rotation of the knee and then also with the foot, we can do pelvis in, femur out, tibia in, and kind of just gesture an inward motion for our tibia. And then tibia out, femur in, pelvis out. Pelvis in, femur out, tibia in, tibia out, femur in, pelvis out. Pelvis in, femur out, tibia in, tibia out, femur in, pelvis out. Pelvis in, femur out, tibia in, tibia out, femur in, pelvis out. And to the foot would be pelvis in, femur out, tibia in, foot spreads out. Foot in, tibia out, femur in, pelvis out. Pelvis in, femur out, tibia in, foot spreads out. Foot in, tibia out, femur in, pelvis out. Last time, pelvis in, femur out, tibia in, foot spreads out. Foot in, tibia out, femur in, pelvis out.
Feels like a nice spiraling, doesn't it?
And I really feel just like I have really supportive legs for my spine.
Mm. I feel like I can breathe more easily. Feels like it just
Mm.
really opens up in my chest for breathing.
Oh, that's wonderful. Well, I think that's about it for today. What
I
do you
think
think?
so. Yeah, we covered a lot today, didn't we?
We
Looking
really
at how
did.
what's going on with the hips and what people complain about and different exercises that we've learned for the hips, but we presented being able to use some different intentions with our hip, imagine them to be eyes and really looking at the anatomy, how the socket works and the bone rhythms. Oh, I think it was great. I loved it.
Yeah, and really important to present an alternative to just a focus being on muscle strengthening and squeezing and activation. This is really by following these images, we're getting all of those muscles to work more efficiently and just more dynamically so that everything is in just the right amount so we're balanced. And I feel
Yeah.
balanced right now.
Yeah, I do too.
All
Yeah,
right. Well,
just
it was
feel kind of open.
it was so great to practice with you, Deborah, and everyone here today. And what do you think for next time for topic?
Mm, we'll have to give that some thought.
Okay, we'll give it some thought
Yeah.
and we'll get back
hmm
to everyone on it.
And again, it was nice practicing with you as well. And all of you, thank you for joining us. We're so happy that you participate with us and we're looking forward to hearing comments on how it helps you in your daily practices and in your daily life.
And if you really enjoyed this practice, please like and subscribe to our YouTube channel. And we would so greatly appreciate you leaving a review about the practice and your experience. Thanks so
We would
much,
love that.
everyone. Bye.
Bye.
Thank you for joining us. We hope you enjoyed the episode. Please like and subscribe to our YouTube channel, and we would greatly appreciate it if you would leave us a review. You can also become a patron of the podcast. Join our patron program to get access to movement practices from each episode, bonus episodes, and Q&As where we answer any questions you have about the practices. We look forward to practicing with you and continuing to share our passion. As we say in the Franklin method, better information leads to better navigation. Keep practicing, and we'll see you next time.